Hi, my name is Tom Buck, and I'm going to talk about current and emerging trends in mobile health technologies, or mHealth, in the world's two largest economies, China and the US. The current state of mHealth. The World Health Organization has defined mHealth as the use of mobile and wireless technologies to support the achievement of health objectives. The National Institutes for Health, or NIH, defines mHealth as the use of mobile and wireless devices, aka cell phones, tablets, etc., to improve health outcomes, healthcare services, and health research. There is no doubt that mobile broadband usage is rising rapidly throughout the world. According to the GSMA Wireless Intelligence Report, the number of mobile internet subscribers has risen dramatically since 2008 and is expected to grow even further in the next few years. If you take a look at Figure 1, you can see how it has gone from 2.3 billion in 2008 to 3.4 billion in 2013 and is predicted to rise over 3.9 billion by the end of 2017. If one examines the number of mobile devices, the figures are even more dramatic. Many people have more than one cell phone, smartphone, or tablet. The total number of cell phone connections was more than 7.4 billion in 2016. That figure is expected to increase to 9.7 billion by the end of 2017. China and India represent the areas with the two largest number of mobile devices. China had more than 1.17 billion devices in 2016, while India had 864 million. Much of the future growth is expected to take place in the Asia-Pacific region. mHealth activities have grown in popularity around the world. A global survey of 114 nations undertaken by the World Health Organization found that many countries have established mHealth activities. The most common activity was the creation of health call centers. Not surprisingly, the difference between developed and developing nations were large. Africa had the lowest rate of mHealth adoption, while North America, South America, and Southeast Asia showed the highest adoption levels. A number of countries have initiatives in the pilot stage or have informal activities that are underway. Analytics predict that the size of the worldwide mobile health market will reach $23 billion by the end of the year 2017. There are several statistical, social, and cultural factors to consider when comparing the differences in Chinese and U.S. urban and rural healthcare systems, including the number of medical professionals per capita, the quality of service, the medical professional training systems, the mobility of staffs, and patient treatment, aka location, preventative care, and insurance. In regards to medical professional numbers, Americans have disparities between metropolitan and non-metropolitan areas. In this table, Table 1, you'll see that American rural areas have about half the physicians, 122 per 100,000 people, compared to urban areas, which is 270 per 100,000 people. The United States rural areas also have fewer medical personnel. Rural areas have about 852 registered nurses and 318 licensed nurses per capita, compared to 934 and 205 nurses per capita in urban areas. As of 2014, there were 1.5 general practitioners/doctors for every 1,000 Chinese, compared to the earlier mentioned 2.4 general practitioners/doctors for every 1,000 Americans. And in regards to training, China has a different general practitioner training programs for different levels of expertise. Similar in structure to driver's licenses in the U.S., where a person can be trained anywhere from 1 year to 5 years and graduate with or without a residency, compared to the U.S., where there are set national standards. There are no national standards in China. In the U.S., general practitioners are considered all on the same level across the board at graduation. And the American medical system and residency program is nationwide and was established over 100 years ago, and by all standards surpasses the highest level of training in China. In regards to professional mobility, medical professionals in the U.S. are relatively mobile and able to relocate to any region, clinic, or hospital in the country without having to retain or meet different standards. But in China, medical professionals seldom change their work locations. Once signing with a hospital, they are expected to work there for the rest of their life. Under the current system, a doctor's professional competence hangs on the standard of the hospital he works in. In fact, standards of hospitals vary so considerably that too often there is no uniform standard for the same disease treatment among different hospitals. In 2012, China overtook the United States to become the world's largest global smartphone market. And as of December 2016, the number of mobile phone subscriptions in China topped 1.32 billion. There are a number of challenges for mHealth. The mobile health market is still small and not widely accepted both in China and the United States. mHealth is complex. Network operators, equipment manufacturers, users, service providers, and hospitals need to work on growing this market and taking advantage of new opportunities afforded by mobile devices. There are policy and legal challenges in both countries. Currently, the Chinese Ministry of Health only allows mobile health service providers to offer consulting services through mobile devices. They are not authorized to treat patients or offer prescriptions. This has slowed the development of mobile health and represents a major obstacle for mHealth growth. In the United States, there also are challenges. One of the most important concerns is reimbursement practices. Right now, most American doctors receive inadequate reimbursement for mobile health initiatives. In many cases, neither public nor private insurance covers the cost of mHealth consultations, diagnosis, or treatment. This has slowed the adoption of mHealth initiatives and made it difficult to reap the benefits of the mobile health technology revolution. Right now, in the United States, the majority of mHealth applications are not regulated because they make general health and wellness claims that are not considered medical in nature. Mobile applications that merely help a person track calories or activity levels may fall within this general health category and are most likely not subject to U.S. government regulation. However, some applications may perform functions that are considered medical in nature. Thereby, those applications would meet the definition of a medical device as stipulated by U.S. law. In regards to the benefits of mHealth, there are a number of benefits that arise from the development and adoption of mHealth. First, mobile health devices offer the potential to improve access and affordability of health care by lowering disparities based on geography and income. Second, they improve administrative efficiency by reducing errors and streamlining medical processes. One of the virtues of digital technology is by improving accuracy in prescriptions and medical treatment. If doctors electronically can prescribe medication, this saves money by cutting error rates. Mobile devices also can reduce duplicate medical tests by making it easier for patients to get a second opinion. Third, mobile phones and mobile-enabled devices aid the patient experience by providing a means to deliver medical reminders and diagnostic information to patients and physicians. And finally, mobile health helps policymakers by encouraging better health data collection and analysis. One of the biggest challenges in healthcare is having real-time data for decision makers. Too often, public officials make decisions based on incomplete data or inadequate information. Mobile devices help facilitate the development of data sharing networks and data analytics that improve the information basis for healthcare decision making. In the long run, better information will improve the manner in which we make major healthcare and budgetary decisions. Finally, future opportunities for mHealth. The integration of mHealth apps has already had a wide impact on reducing hospitalizations and emergency visits throughout the rural healthcare spectrum by improving communication and care coordination among specialists, doctors, nurses, and others. Research has shown that in rural settings, hospital readmission rates have been cut by 92%, while emergency room visits dropped by 87% with the use of mobile health apps and greater communication among both patients and providers. Remote monitoring devices represent a fast-growing part of the mHealth sector. According to a recent report, the Chinese medical monitoring services market will reach 1.2 billion by the end of 2017, and over 90% of the revenues coming from chronic disease management solutions. They also predict that monitoring services will dominate the worldwide mHealth market, and that by the end of 2017, monitoring services will reach about $15 billion. The next two largest market subsectors are diagnosis and treatment. In closing, the mobile health application market has the potential for huge growth. In China, there are about 2,000 mobile applications. Studies have found that 40% of smartphone users are expected to use healthcare applications by 2018. Across the board, mobile applications provide medical services for users through mobile terminal devices, which will shorten the distance between the healthcare provider and the user. It will help the user save time and allow doctors to treat their patients more efficiently.